just for the muscle groups that are in your lab. Note there are different ways to stretch these muscles. You're not wrong if you choose these, but these are popular. So for levator scapula, you'll recall that there are different fiber angles, but generally a really good one is if you get them to sit on their hand, that helps to depress their scapula. And then you get them to look towards their opposite pocket. So they're looking this way, which is a side flex away, rotate away, flexion downwards. You get them to take their hand, and then, you know, they can overpressure at the top of their head, but even closer, like getting further down on the head, they're gonna be more specific. And hold. And so a lot of times for neck stretches, we can do 20-second holds. And yeah, that's wonderful to try it now while you do it. And to note too, it's not a pure side flexion, but you do want a rotation and downwards to bias. And telling them where you're palpating and pointing out. So this is a stretch that you're gonna do at home. The purpose is to help improve length of it and then to help with your pain. This is where you should be feeling it. You must tell them, because they don't know necessarily where the levator scap muscle is. So if you palpate by the scapula where it is and where it inserts into the spine, that's wonderful. So the anterior middle scalenes, if their chin is tucked and they do a side flex, that's good, and you can have their hand here or here, adding overpressure. That more so for the middle scalenes, but the important thing is that their chin isn't out. Their chin has to be tucked and relaxed, and then pure side flex. And then again, you're telling them this is where you're going to stretch it. And then for the anterior scalenes, if their chin is tucked, their neck is in a little bit of extension, and then you side flex, they're going to feel it in those fibers a little more. So it's chin tucked always. Pure side flexion is more middle scalene with a little bit of so chin tucked, a little bit of neck extension, axial extension. You can do that, and you're just feeling, and so a little more chin tuck. Yeah, good. For the pec major and pec minor, you can stretch these at home at the same time because essentially the fibers, some of them run the same way. Pec major is really good, so you have to follow me. I'll show you in a doorway. So if you want to stretch one at a time, I'll show you in the door, and then two at a time you can also do in the door. Now, because of their different angles, figure out with them where do they feel bigger stretch. So I start here, rotate your body away. You can tell them to put their hand on their chest as well. Put a little pressure, rotate their body away. You can tell them to play around with it. Again, it depends on the patient and the purpose. If they have their hands higher, at a higher level of abduction, they might, if they feel a bigger stretch, this might be where you focus. You're going to stretch the pecs in all, pec majors in all of these positions. It's kind of what they need to stretch it. Or maybe it's that they're doing multiple. And so, of course, you're saying this is where you want to feel a stretch. It shouldn't be painful. It should just feel like it can be slightly uncomfortable, but as long as it's not painful. And that's key because some people perceive the stretch to be painful. So saying that the goal isn't for it to be painful, but if it's a little bit uncomfortable, that's typically fine, depending on the patient. For the pec minor, you could, with your hand up in this position, you can really focus a little bit more on the pec minor. You can use a stick and lay down on the bed to stabilize your scapula. And with a stick, you can use this hand to push your arm over. So up and over to stretch the pec minor. We don't have a stick right now to show you, but that's a nice pec minor stretch too. But certainly in the doorway, you can grab the pec minor stretch. And if we're going with what research says, holding for, again, depending on the patient, holding and what the therapist has directed, etc. But holding 5 minutes, taking a few breaks in between, like it could be after every minute approximately, but 5 minutes is the target. For subscapularis, so you can stretch it with external rotation with your arm at your side, because we know the subscap internally rotates, or you can stretch it with the shoulder at 90 degrees abduction. You can stretch it here. So certainly in the doorway, you can stretch it. But typically if these people have restrictions, so again, This can be people who've had frozen shoulder, coming out of frozen shoulder. They've had rotator cuff tendinopathy, and they've just gotten stiffened up from not being painful to move. With a stick, and again, I don't have a stick, but holding here, keeping the elbow tucked in and pushing into external rotation. So their elbows tucked in tight, you're pushing into external rotation, and that's nice because then they can put their pressure of their elbow against their body and they can really hold that stretch. And that's a nice one for the subscapularis. So you're also getting the shoulder capsule as well. For the lat dorsi and teres major, I'll demonstrate on the ground. So we know both of them extend and internally rotate. So this is what they do. So we want to do opposite, flexion and externally rotate. So here, with the palm up, you can also flex one way to bias the left side and side flex to the left to bias the right side. So you can play around with that. You can do that stretch up against the wall if they can't get onto the ground. But having the palms up is a way to bias it. For the gluteus maximus, bringing your knee to your chest, because it's a big hip extender, lateral rotator, bringing your knee to your chest, just as you did it for the patient, they can do it themselves. So laying on the ground, knee to chest. You can bring it a little into internal rotation. That would be okay. And then for piriformis, we know that below 60 degrees, it laterally rotates, it abducts at 60 degrees, and then it internally rotates above. Enough to say, we did manual stretching the way we did in last week and in the video, but a really good stretch we can teach for home. And I find that stretches that are more convenient for people, they're more likely to adhere to. So if you can give somebody stretches that are in sitting position or things they can do during the day in the office, some people, if they're at a place they can get onto the ground or have a mat, great. But otherwise, it's nice to give exercises like that. So in this position, you can put pressure here. You can get them to lean over, and that's good for the piriformis. And then on the ground, similar to the stretch here, this would be enough. You can get them to push on. You can slide there, tell them to slide their heel towards their bum. And then the bigger stretch is if I pick up my right leg, that's a bigger stretch for my left leg. And so those are ways to play around with the piriformis stretch. And even to remember that one on the back is very common. And so to know how to make it harder and easier and to grade it, that's wonderful. So bringing your heel towards your bum, and you guys will try it yourselves if you haven't done this already to understand. But once you pick up that other thigh, that is definitely more aggressive and more of a stretch. For the adductors, lots of different stretches you can do. You can simply do standing. So as soon as there's load, like your weight on here, it's going to be more. Cut me off at 10 minutes, okay, actually. This is an okay stretch, or you can go the other way, lunge to the other side. People do here, just stretching out the legs. You can feel it there. Sometimes people do it against the wall. Their bum is against the wall and their legs are against the wall and they fan out. You can do legs spread apart and lean forward. So there's different ways to stretch the adductors. Hamstrings. So I want to talk to you a little bit about this, because when we stretch the hamstrings, we want to pay attention, especially for some patients, that we're not stretching the whole neural system of as soon as the head and neck are down, if that person has neural irritability, and if they have a positive slump test, which we'll get into, then we don't want that to tension for it, and that could reproduce their symptoms. So for the hamstrings, for example, doing this is more tension on the neural system. So yes, you could, okay, try to touch your toes. Yes, you're stretching, but you're also really loading up that system. So another better way, standing.
10 minutes.
Okay, cut it.